There are lots of treats and good food to enjoy this time of year, but there are some ways to still treat yourself and your waistline.
We bring in Avera Heart Hospital dietitian Kaylee Gebhardt, who says that there's some ways for us to accomplish those goals. We appreciate you joining us this morning.
Thanks for having me.
So obviously Christmas, I want to throw in Thanksgiving too, some New Year's indulgences too, some drinks. There's a lot going on. So is it realistic to still have fun, but also kind of attain a diet goal?
Absolutely, yeah. There's definitely plenty of things to, eat healthy and still enjoy your holiday season with your family and friends. There's things that we can do and things that we can maybe eat in moderation as well.
What would you say is your what's the number one indulgence that people do too much of that maybe they should dial back of, or what's probably their easiest go-to for avoid this, avoid that, maybe do a little bit more of this, a little bit more less of that?
Yeah. I would say most Americans in general typically tend to eat a lot less fruits and vegetables than we really should in a day, and eat a lot more added salt and sugars than we should. So, limiting the sodium intake to no more than 2,300 milligrams a day and limiting as much added sugar as you can, which tends to be hard during the holiday season because all those sweets and treats and all that good stuff. But like I said, enjoying those things in moderation is definitely okay on those two holidays.
So looking forward to the new year, how can we kind of prepare ourselves going into 2024 and setting maybe a New Year's resolution of, I want to be healthier, I want to work out more? What does that kind of look like for us?
I would say be realistic with yourself, trying to do things like set one or two small goals for yourself, so if you're trying to upright your whole diet and your whole lifestyle, that tends to be unrealistic for most people. So one or two goals, like trying to drink a glass of water instead of drinking your soda in the afternoon, or maybe trying to eat a fruit and a vegetable with your lunch meal, or maybe you're not a big breakfast eater, so maybe trying to eat a breakfast meal, whole grain toast and a piece of fruit or something along those lines. Pick one or two small things and be realistic with yourself.
When you hear people that are trying to reach these goals, do you give them a good mile marker and say, like, maybe 15 days into January, kind of assess yourself and see where things are going, just so that they don't fall off for the entire year, I guess? Do you ever have that?
Yeah, not typically, but I definitely think that's a good thing. Or, trying to set goals with a partner or a friend or somebody, saying, hey, you want to go for a 15-minute walk on your lunch break or take the last minute of this, and then we can set a new goal at the end of the month or whichever that may be. Typically, I say within the next couple of months, reassess your goals and maybe add something else to continue improving your health. So.
Definitely. And so aligning exercise with healthy eating, what does that kind of look like? I know I've heard many people say a lot of it is the healthy eating that really makes a difference.
Yeah.
Is that true?
Yeah, I mean, eating and exercise, so nutrition and exercise needs are going to vary from person to person, so both food and exercise wise, like I said, is going to be different. But exercise is still a very important piece to that puzzle. So still continue to, like I said, 15-minute walk or trying to get people go by steps, which is fine. But any little bit does make a difference. So eating or exercise wise. So.
And
Great.
for you personally, I know you've worked with some people here. Have you had some personal success stories where people have either attained these goals, maybe even gone above and beyond by chance?
Absolutely, yeah. A lot of it tends to be weight loss goals. I feel like that's what people tend to look for in the new year is, I want to lose this much weight or this. I would say if you can start by trying to set a goal of, like I said, the fruit or vegetable or water, whatever it is, and then down the line you might see weight loss, which is maybe what you're looking for. But definitely people are successful checking in with them and following up, and then even more successful down the road, which is fun to see. So
Definitely awesome. Well, thank you so much for coming in today, Kaylee.
Thank you.
We loved hearing more about it.